Hello and welcome to the Digital Health Hackers podcast, where we go through people in the healthcare industry and especially the health IT industry with significant contributions. And today we have Luis Falcón with us today. He is a doctor by profession and then one of the main contributors to the GNU Health Foundation and a big advocate of social medicine. So, hi, Luis. Nice to have you here today.
Thank you for having me.
So, Luis, how did what's your story? How did you get started?
So, GNU Health project starts pretty much in the early 2000s, 2006, in the north of Argentina. It originally was a project for rural medicine, where we try to provide some technology for rural doctors and health professionals that were living on these underprivileged areas. Then Richard Stallman adopted the project and made it an official GNU project. That's why the name of GNU Health. And yeah, then different of have been contributing to now not only more of an ecosystem of health where you have things related to, of course, social medicine, but also you have things related to genetics and genomics and laboratory management and personal healthcare and mobile applications and so on. So that's in a nutshell what we've been doing for this over 15 years now.
Amazing. So, how many of you are actually the core contributors?
Yeah, well, it's hard to know because, if we just look at the universities and the people working in different universities and different academic institutions, there are a lot of people. So it's kind of a decentralized project, right? It's more of a confederation of people and institutions around the globe, but we do have around 15 people per se that work in different areas. So you have people working on translations, you have people working on documentation, and then of course, in when I say working, is pretty much leading those areas, right? And then now for example, we have guys working on making sure that free hardware, open hardware connects to GNU Health by different means. So it's I would say it's a pretty large community at this point of multi diverse backgrounds.
That's really interesting. So, GNU Health, I think when you started it, you were a practicing doctor and you were just doing this on the side.
Yeah, well, the very first step, we were at these rural areas of Argentina. They were public schools, right? So we were providing GNU Debian distributions to put on the libraries. So the kids will play with math, and we will talk to the teachers and kind of approach them to technology and provide some technology for them using free software. But then I noticed that these kids needed more than just technology. They needed the very basis of dignity, which is proper shoes and proper clothing and nutrition and the basic. things that we need to be healthy and have a dignity in our lives. And that will ring me the bell. I said, well, let's reflect a bit and go back a bit to the roots of what these kids need at this point in time. And that's where I said we will keep on providing technology for the libraries, but let's focus on social medicine and let's focus on the quality of life of these kids, not just at the school, but also on their daily activities. And that's what triggered the thing of integrating primary care and social medicine into technology. And I think it's a kind of a unique project in that sense, because when we look today at the most electronic health records, many or most of them are focused on disease. They are, how do you code this, whatever, hepatitis or cholera or whatever. But our approach was different. Our approach was, how can you prevent people from getting sick? And I think that's pretty much primary care and working in that sense, and giving the health professionals the right tools from the reporting point of view, from the demographics point of view, so they can work on that layer and then build up with a strong foundation. That was my idea, and it's still my idea. And I think that I come from a genetics background, so that's in the genome, right? So that's in the DNA of GNU Health. That's the main core. Yes, of course. Then you can do all sorts of things related to healthcare. But I strongly believe that if we don't have the social medicine as the foundation, it's very hard to build something sustainable for our societies. That was what actually triggered me to say, let's put social medicine into technology.
That's amazing, actually. That's, the usual traditional approach of medicine is not really healthcare, it's sickness care. Once people come into the system and they're sick, they do whatever they can to treat them. But I think healthcare and social medicine as a whole is probably the place where there is the hugest return on investment if you put $1 in prevention versus cure, right?
Absolutely. I fully agree with you. I actually call it the system of disease, right? What we are living today in the Western society, or most countries in Western society, they live in the system of disease, and that's definitely unsustainable. And we see it in countries like the U.S. It's going to collapse because the healthcare system cannot deal with so many epidemics of poverty, of poverty-related diseases like obesity, homeless, and so many other things that we see in the so-called developed countries, right? And we do have the moral obligation to actually work on that level, on that foundation of society, because it will make things much easier for all of us. I mean, you are also a physician, right? And I think that it's heartbreaking to see that the basics of the healthcare is not being taken care of, and the pharmaceuticals are just making a lot of money from working on that system of disease that we were talking. I think that we need a shift on the paradigm, and hopefully GNU Health will provide just a tiny bit of that shift.
Sure. I think this is some of the times it's not even the doctors, it's not that they don't want to do this. It's that the tools are not ready for them to really provide social health and look at the patient from a holistic perspective, right? And so, what do you think? Do you think GNU Health and the contribution you made in Argentina, what did you first start tracking? How did that change the situation there?
Yeah, well, we've seen it in different countries. As a matter of fact, GNU Health was used in Argentina as a real-time observatory for the COVID pandemic. And we need data. That's key, right? One things that they've been doing, it's tracking and preventing human papillomavirus infections, right? That we know that they are intimate linked to cervix cancer. And the way they do it is they work with ladies in rural areas. So now they have a self-test that they can do at home. So, they don't have this problem of going there, and all these social stigmas that still exist in many areas of the world, and that is having a very drastic and positive impact in these ladies, and by preventing, doing primary and secondary prevention activities and measures, and that is actually reducing the prevalence of cancer, and that is beautiful, and that's one of the very best examples that we can see when you put people before patients, when you treat the healthy communities before actually they get sick, because yes, that's doing things on the not the reactive way of doing things as we are doing now, but from the proactive point of view. And of course, then when you look at the socioeconomic stats and functionality of GNU Health, and when you start looking at things like education level, housing conditions, where they have sewers, where they have heating, where they have, what's the overcrowding conditions in many places that would lead you to contagious diseases like tuberculosis and things like this, working with the nurses, working with the social workers. I'm really excited about all these changes that we are being able to provide to the public health communities with GNU Health. It's really amazing, and to see how I think that things come naturally, right? And when you see why GNU Health it's being successful and the level of adoption is having, it's because it's a natural thing to evolve, I think, in healthcare, and I'm very proud of that. I'm very proud of the community in that sense.
Amazing. That's real change happening because of software. And wanted to ask you a question regarding separating the use cases from the actual platform, right? So there are hundreds of different use cases in how certain things can be applied. So, for example, HPV in preventing cancer, or tracking the sewage pipelines and occurrences. So, what's your opinion on how GNU Health should be designed, or how do you separate out the use cases that are local in nature versus GNU Health as a platform, which is more like everybody will be having the same code base, right? So how do you separate these two things out?
Well, if I understood you right, we need to have multidisciplinary teams in terms of For example, when we talk about sewers, or when we talk about the quality of water that people get at home, checking, for example, the levels of arsenic or whatever. GNU Health has the laboratory system, which not only applies for humans, but also for non-human animals, and sometimes just to check the quality of water, as I said. But you need somebody to do it. I get quite frustrated when I see people using GNU Health and not putting this demographic part into it. Like sometimes they just jump into the clinical practice. We need to have. I think that, for example, the best. I would say that the best implementations are when the public institutions are into it. Meaning, when you put it into a municipality, it's a joint effort. So you have the academic institutions, then you have the mayor, then you have the social workers, and that multidisciplinary team is what makes GNU Health meaningful. That's what brings meaning to the project itself. So yes, we provide the technology, but technology by itself is nothing if you don't have this human factor of people, of knowing also your community is key. Making sure that you reach out those people that they, as I said before, with the HPV prevention, social workers would go to these ladies' houses instead of the lady coming to the health institution. And those are key components. Checking the levels of arsenic in water, the same. And so there are so many social diseases that can be preventable by doing these things. So how we articulate them. Yes, of course, technology is a very important piece, but we need the people to actually articulate it. And then, yes, of course, we need to use standards. We need to use things that no matter where you are in the world, somebody can actually reach and see through open science what's going on in different places of our beloved Earth, right?
Got it. So I think like healthcare is global, and most of these things are global. So designing it right for one particular demographic then extends naturally to almost all other demographics.
Yeah, and look at the tuberculosis key, right? So we have TB pretty much all over the world, and I would say it's one of these the paradigm of social disease, right? Because 1/3 of the globe population it's living with the mycobacterium, but those that really get sick are the poor in the end. Are the ones don't have proper nutrition, are the ones that don't have proper housings, are the ones that live on the streets, are homeless, or on overcrowding conditions. Those are the ones who actually get the clinical TB, and it's a pity. And yeah, that exists. As I said, it exists in India, it exists in New York, it exists in Bangladesh, it exists in South Africa, it exists all over. And in the end, it's the poor, it's the underprivileged that actually suffers the most from it. Arsenic, the same. When you look at the type of soil that we have in many areas in South America, in Asia, in Bangladesh or wherever, they are rich in arsenic, and the people drink that water and then they get very sick. And there are ways of actually preventing those social diseases, but we have to put the means there. And it's a pity that doesn't show on the news. The news are always showing the reactive thing, or whatever pharmaceutical invented, and it's a pity. I think that there is so much work to do on the prevention level, and yeah, putting the resources into the people and not only into a few very powerful corporations.
Amazing. Yeah, that's like, I think tuberculosis and malaria combined probably killed a lot more people than COVID ever did. But we see what we can, it's something that's obvious, and we fail to see the background that's actually causing a lot of these issues.
Yeah, and it's you see. I don't know whether you remember the Ebola crisis in some Western Africa countries. Ebola has been there for many years, but it was only when the rich white men got infected that they decided to invent and work into some vaccine or something for Ebola. Until that happened, thousands, if not millions, of people are dying in many countries in Africa continent because of social diseases. And one, of course, is TB. You mentioned malaria, of course, Ebola. But of course, if it doesn't touch the rich white men, that won't go into the media, and that is very sad. And we as a society have to change that.
Mm-hmm. So, Luis, what are your future plans? What is the future of GNU Health and your career look like?
One of the things that we are doing at this point, it's been a couple of years already that we've been working on it. It's reaching out to the person, to the individual, and integrating the individual into the system of health. And my GNU Health, it's an application that can be installed on desktop, and now we are also providing it into mobile devices. So the person becomes an active actor in the system of health. I think that that's very important because you can talk to your nurse, you can talk to your psychologist, you can talk to your social worker or doctor, and you can check your blood pressure from home, you can check your blood sugar levels from home, and even your emotional state and your psychological status, which is also very important today. Mental health is the other thing that we need to. That's my dog, by the way. So that we need to work into it. It's social and mental health, which is one of the things that have been kind of left aside, and by providing these tools to the individual, I think that we are making them an active actor of the system of health. So that's one of the things that we are currently working on, and also I think that the GNU Health Federation itself. Making sure that we can integrate not just one single big large hospital, but thousands of primary care centers and clinics and whatever around the world where we can actually have good quality data that will integrate not only the molecular basis of disease, but also how the environment affects us as human beings, And one of those is what we call the Global Exposome project. We have this project that is called the Global Exposome, which deals exactly with that. How the what we eat, how we sleep, and where we work affect our health in one or another way. And for that, we need to have a lot of data. Things like epigenetics, cancer, autoimmune disease are complex, multifactorial disorders that we need to better tackle them. And I think that the environment is one key factor that is not being addressed enough or properly until now. So those I would say that those are the things that we are integrating into this ecosystem that I was mentioning.
Okay, that's so the patient health record and empowering the patients a lot more. Research based on the data that you're already collecting in GNU Health, interface between different hospitals and different systems. And I'm just curious, like, how do you, if multiple systems are running GNU Health, how do they interact with each other? Do you all just need to have one single database, or is there a protocol to share information between two different GNU Health systems?
Right. So we have what we call Thalamus. Thalamus is a message server that allows you to interact not only between GNU Health system. For example, my GNU Health, which uses a completely different technology than the hospital management information system, can be plugged into the GNU Health Federation itself by means of Thalamus. So you can actually create federations of federation, what would be kind of like a confederation of systems, right? And by providing these APIs, I think that is the best way of approaching this federated, distributed model, because each system is autonomous, meaning you decide what are the things that you want to share, what things you want to remain private within your scope. For example, in the hospital management system, human resources, it might be something that you don't want to share because you might say, well, this doesn't really provide much information. So you say, well, these models won't be part of the federation. And the same as in the personal health record. You might say, or you might want to keep private some stuff that, has to do with your psychological status or mental health or whatever. Whatever you think that you don't want to share, you are most welcome to actually just keep it private. And but this sort of APIs that we provide allow you to create very large databases, of course, keeping in mind the privacy of the person, right? You can actually send stuff in an anonymous way, or you really have to make sure that patient privacy will always remain at the highest, right? But going back to cancer research or neurological disorders research, the only way we can actually find correlations between the genome and the actual physical condition or disorder is by having these very large databases, and that will include the molecular basis, your genome and your DNA or whatever, and also your lifestyle and environment and all the things that will might have also an impact on your health and or in the expressions of these genes or whatever.
Yeah, so like the HPO codes and human phenotypes, and I think there's a lot of interesting protocols. Phenopackets, I think, is one of them. But it's really interesting. So Thalamus, how does it compare to, say, existing standards like HL7V2 or FIRE? Is it based on these, or is it its own protocol?
Yeah, so basically, Thalamus is a message server. It's not a message standard by itself like HL7. Um, you can, the way that you want to encode that packet or that packet that you are sending over, it's up to you. What we make sure with Thalamus is that the requiring party has enough rights to actually, read, write, or whatever operation wants to do on the other side, and then the packaging itself, it's up to you. And you brought up something very important, which is HL7. I think that. We need standards. We really need and HL7 Fire. I think that it's a very nice approach to it because yeah, it's open. It's clearer than that version 3 and version 2 that were a bit more complex. And I think that the EU is actually now, the European Union is actually embracing HL7 Fire, and that's very good news. We do need standards. For example, in Thalamus, we use XML for many basic and resources, and it works very well. So in the end, it's no matter which standard you use, as long as it's open, we can adapt it and we can send it. The problem is when we cannot access those messages. That's where the problem comes. That's why open science and free software is so important in healthcare, because we don't have to be reversing engineering things to get the message. It's something that it should be open, it should be accessible to for the advancement of society in the end. And I think that the inclusion in FOSDEM, I'll be giving a talk about GNU Health and the inclusion of free software in the European community next week, I think, yeah, in FOSDEM. Because I think that the public administration must embrace public standards, must embrace free software, both in the public administration and more concrete on the healthcare sector. It's key. And if you see what's going on today, most systems are private in the healthcare arena, and those are black boxes. We don't know what's going on there. Then they say, oh yeah, well, we use this standard. Yeah, but your system is closed and we don't know what's going on behind the scenes. When you generate a prescription, for example. Oh no, because it gets printed. Yeah, but what happened between when I hit enter and when the document got printed? I don't know what's going on behind the scenes. And that's where free software should show up. And that's where our public representative must adopt free software in the public administration and more specifically in the healthcare sector.
Absolutely agreed. And I think having that openness on at least what's going on, having the source code to look, okay, that's what's going on, makes a huge difference. And it even speeds up innovation, I would say, because people can then fork it, do what they like with it, and meet their own use cases. So I will definitely be looking forward to your talk at FOSDEM. Maybe if you have a link, you can also, we'll put it down in the description for the audience to check that out. So anything else you want to tell the audience, Louis, before we end the podcast?
No, I just want to take this opportunity to invite you, those that are going to be in Brussels in FOSDEM in a couple of weeks, to join us. We'll have a stand there, so you can ask us any questions you might have, both for your health center or for your country. We need to speak up to our public representatives, and no matter where you are in the world, just go there, ask them, and it doesn't matter. It doesn't have to be GNU Health. I don't really care. I mean, in the end, what is important is that the Free Software Foundation has Europe has this campaign called Public Money, Public Code, right? It's our tax money. It's something that it has to come back to us somehow, and we cannot be putting our tax money into large corporations that they don't really care much about our health, but their pocket. So invest in free software projects, no matter which one they are. They are always going to be good for our society. And if you go to FOSDEM, I will be looking forward to seeing you there. And thank you for having me here. It's been great sharing this time with you.
Definitely, Louis. I think really great points. I just hope that the video was a little better, but I think I'll do something in the edit. And again, really good to have you here. Thank you for taking the time.